What's this message, Colin?
Is she with a patient?
Oh.
Hello everyone, we're back after taking a bit of a hiatus from our monthly Facebook Lives, bringing you stimulating content from Oceania and abroad. I am super excited for tonight's guests, Dr. David Kerr and Robyn Russel, who will show you how to make your dental hygiene department intentional, profitable and effective. Please give them a warm welcome by joining me in a toast to David and Robyn. So thank you both for giving up your evenings. And you have reminded me not to mention anything about last night's game, so I'm not going to refer to it again. So dental hygiene departments have been around for a long time, but are often considered to get cleans out of the dentist's schedule. David and Robyn will challenge this and address ways to innovate, empower and drive productivity, work towards a multidisciplinary model of practice to be a profit centre, and ensure outstanding outcomes for our patients. I'm really looking forward to it, so I'm sure you all are too. Please feel free to post any questions into the comment section below throughout the live, and David and Robyn will answer them at the end of their lecture. The virtual room is yours, guys.
Thanks so much, Danielle. And look, thanks so much, VMS, for the opportunity to speak on this topic tonight. I apologise for my croaky voice. It might sound like I'm on the episode of a footy show or something, but it got a bit exciting up here last night at the State of Origin, just to rub it in one last time. But look, dentistry is transforming. We all know that. COVID's made us all sit back and think about what's been happening. But really, the care models or the dentistry care delivery models are really different to the way they were even 5-10 years ago. Traditional dental practices, family, suburban sort of dental practices have really evolved. And, I remember sending out recall postcards, etc. Those days are over, and as are the days where patients will recommend, do the treatment we recommend. Okay, it's just not that easy anymore, and they don't think that's necessarily a good idea. As far as having hygiene departments, and we're going to call hygiene departments preventative departments because we all know now that with our extra tier of clinicians we've got available to us in private practice, not all of them are dental hygienists. We've got OHTs, now we've even got OHTs with adult scope. So we're going to talk a bit about this tonight and how that can be integrated very simply and effectively into a practice. But look, many practices have had hygiene departments. We've had one for 25, 30 years. And I'd have to say that for the majority of that time, even for us, that department's really been half baked or half done. And I suspect, and the people I speak to as well around Australia feel the same way. Hygienists and OHTs are often integrated into a practice where practice work, it's too busy, or the dentists are getting too busy and they just want to move some of their recall stuff out of their schedule. What I'd like to propose and deliver tonight is some compelling evidence that really these departments can offer so much more to our practices and probably most importantly of all to our patients. And not to mention to ourselves as well as clinicians. We'll talk about that in a bit more detail later. I mean, to introduce myself, my name's David Kerr. I'm a general dentist in Brisbane. I've got a practice on the north side of Brisbane. We've got an 8 surgery practice and we're reasonably large, but I suppose we're a little bit unique. We've only got 2 dentists that work here, but I've got 5 OHTs that work in our practice. And I feel pretty passionate about this model and it works very well for me. I'd like to introduce my colleague Robyn Russel. Robyn's an OHT, has been in dentistry for a long time, over 25 years, I think, Rob.
Yeah.
But has been an OHT for over 15. Rob's a bit unique too because she's got a degree in psychology, which makes her very valuable in this space. we've both together started the Facebook chat group, Dental Health Network, which I encourage you all to join. Dental team members, clinicians, practice owners, I don't care. We're trying to set up a group that's essentially set up to support people. We've got some intentions to provide some education on some things that we're passionate about. But we really want to encourage open and honest communication between all members. We want to have the conversations that need to be had in dentistry. Check the group out. We get some pretty robust debate going at times. It's very respectful, very professional, and I really encourage everyone to get on the group and be part of it. But let's get started.
All righty. Hi, everyone. Thanks so much, Tabitha and Danielle and EMS for inviting me along tonight to talk about the intentional, profitable and effective preventative departments. From an OHT perspective, I'm really excited to talk about this tonight because often these presentations are delivered by practice management consultants or practice managers. So it's a bit different and a bit exciting to be an OHT to actually talk about this. So this topic is one that's quite close to David and my heart, and we wanted to discuss or investigate the reasons why we thought this is important. One of the big reasons is a lot of people have never had a dental hygienist or an OHT before, so don't really understand how to utilize this practitioner in their practice. A lot of dentists think it's a great idea to hire a dental hygienist or an OHT, but they don't really understand how this practitioner is going to fit in before they hire them. Sometimes they hire someone and just tell them, well, you run it, you run this department yourself and do what you want to do. And sometimes it becomes unstuck. There's a lot of problems or biases out there as well. Practice owners tend to have a bias for or against a hygiene department. There's a general argument out there that hygienists aren't productive enough. They need to produce 4 times their salary to make financial sense. A lot of practices now are choosing to hire dentists rather than hygienists, in that they've got a higher scope of practice and they're seen to be more profitable, to have better cost benefit analysis. And David and I want to unpack that a little bit and discuss that further. There's also a lack of alignment at the moment between dentists and oral health therapists. It's a lot of assumed knowledge either way. Dentists don't really understand the scope of practice, what they do. And then hygienists and oral health therapists don't really understand what the dentist expects of them in practice. And these assumptions, everyone is coming unstuck again there. There's also, at the moment especially, a bit of a lack of respect for each other in this space. COVID has really highlighted this. I think a lot of us have seen some of the discussions on Facebook groups and seen, especially out of the US, some of the angst there, the PPE wars and some of the issues. And I think this is a real danger for our profession. We don't need to compete against each other. Dentists and hygienists and OHTs all have a differing scope and all have a place in the dental field. All right.
Thanks, Rob. And look, I'll carry on in this conversation to talk about the role of a dental hygienist or an OHT in private practice and why they're an amazing resource. Because look, like dentists, these clinicians are critical thinkers. They're trained to make and solve problems, I suppose, and taught to think critically to make diagnoses. They understand no patient's the same. Each patient presents with their own problems, their own personality issues, their own agendas, their own concerns. They've got different goals and they've got different oral health status. OHTs and hygienists are so capable of building a bond of trust with these patients, and there's such an enormous benefit to a practice. The second thing is they've got extensive knowledge. They're tertiary educated. They go to these, they're producing very, very well educated practitioners. They do most of the same stuff the dentists do. They're very well-rounded clinicians and professionals. And I think the thing in my time, and we've been, employing dental hygienists and therapists for over 25 years is that they all love it. They all love what they do. They're all excited about it. They keep up with the technology and new products, and really stay on top of all aspects of dentistry in my experience. The third thing is that they're skilled. Now, you've got to be a dexterous person to be an oral health professional. There's no question about that. But they've also got skills in communication for the most part. They understand what motivational interviewing is. They understand how to empower patients to take control of their oral health and their own general health in broader terms. And that becomes a very, very powerful, thing in your dental practice as well. And I suppose, lastly, no one that I've come across, I've never met a dentist that's passionate about treating perio or treating children for that matter. This group of clinicians certainly are, and they love it, and they love their role in it. They love doing it, and it's something us dentists should sit back and have a good look at as well. Now, from a practice management perspective, why do we need dental hygiene departments? Well, from a practice management perspective, we need a system for patient retention. There's absolutely no question about that. We need a way to develop the lifetime value of our patients from a business perspective, but we need a strategy to develop a lifetime patient retention strategy for the good outcomes of our patients as well. Understanding that patient journey is a very important part of that. I think we need a hygiene department to provide healthcare messages. And by that I mean, we all know now, it's not hearsay, that the oral systemic health links are not BS anymore, that they are real. I think we owe it to our patients to provide that information to them. These departments are a terrific way to do that. And look, I think that just strengthens your retention strategy moving forward. The third thing and the third value of having dental hygiene departments and OHTs is for harvesting higher production dental treatment back to the dentists. These staff members are very capable of treatment planning these things, whilst capable and calibrated, and they're very good at made aware of identifying things that are beyond their scope. And from a dentist perspective, that's great, because it really allows us to spend most of our time doing more productive duties. There's no question about that. And I suppose lastly, from a dental hygiene department point of view, is we all need a good perio program in our practices. It's one thing that I think, if we're all being open and honest, we all know that, the prevalence of periodontal disease in the population can, sometimes be reported up to 50% of patients, depending on age, of course. And none of us are spending half of our time treating perio. I think it's poorly diagnosed, and I think it's poorly treatment planned for the most part. And just getting that part right on its own is doing a terrific job for our patients. It's providing, good healthcare messages moving forward. It's driving retention strategies as well. And I think it's the right thing to do for our patients as well. And even better than that, when we start talking about the multidisciplinary model, where we start layering the scope of these clinicians in our practices with our dental hygienists, OHTs and OHTs now with adult scope, and trying to get everyone working at the ceiling of their scope, we can add all sorts of other clinical duties to these departments, including, paediatric dentistry for the most part, adult general restorative dentistry now with the adult scope clinicians coming on board. And look, there's a whole bunch of other adjunct services that I haven't even spoken about and probably won't speak about tonight. Myofunctional considerations, sleep dentistry. There's a whole world of stuff going on out there that is just different to having another associate dentist. And I've found having another associate dentist to be cumbersome at times. I've found it to be, well, you're just trying to clone yourself. And that's a very hard thing to do. No one will ever clone me. I think I'm pretty unique. And that's a bad thing, let me tell you. But a very different way of looking at things, that's for sure. So to understand hygiene departments and our sort of mid-tier clinicians, I suppose, I think it's good to understand why those departments are important. Understand the patient journey from a business point of view, but also from a practice point of view as well. So we all know that we all market now. I mean, I'm a bit of a dinosaur. I was just talking to Danielle before. She asked me if I was going to create a watch party for my Facebook, and I just there going, what the heck? But we're all marketing on social media now: Facebook, Instagram, Twitter, Google. We've all got websites. We're all driving patients to our practices, and that sort of marketing produces a suspect. Someone that suspects that you might be able to do something that they think they need or they want. Our team's job really is to convert that person that suspects we can help them into someone that pretty much thinks we can help them, a prospect. And there's some wonderful training teams can do to help that. That's, we'll have phone calls, emails, etc., etc. I know Renata's running some short courses on front office phone calls, for example, which are very, very helpful. We should all be spending our time on our teams, because remember, if it all cuts here, all those marketing dollars just get wasted. But a prospect will become a customer when they make an appointment. So a prospect becomes a customer when they make that appointment. And if they only come in once, well, sometimes that's okay. And it always happens, doesn't it? But that's the leaky bucket syndrome that the consultants always talk about. We've all got people in our practices that are customers. They just come in when there's a problem and they disappear, and they come back when they've got the next problem. And that's fine. That's fine. But when our customers become regular, they're really our clients now. And, our team's got a huge role to play in this journey up the loyalty ladder. And our clients are regular, then they become probably more social. And we all know patients like this, where when they come into the practice, it's more like it's more like one of your bloody cousins coming over to visit or something. It's more of a social visit than a serious healthcare visit as well. But our friends will become advocates, which obviously refer in a passive fashion, and they're really great. And our advocates will become evangelists if they really, really feel strongly that they really like what we do. They'll tell everyone that listens. They're the patients that put Google reviews on. These are the patients that walk around with your business cards in their wallet to give to anyone that mentions anything about teeth in passing. We all know these patients, and these are our gold patients. That's why they're in gold, because these are our patients that we all love to treat with almost overwhelmingly. I mean, there's always a handful of patients that are a complete pain in the ass, but for the most part, these are the patients that make our days great. They value what we do. We love seeing them. They actually don't mind coming in. They trust us. They listen to what we've got to say. These patients, the gold patients, drive this loop of referral as well, okay? And I would argue that they drive patients back in straight into the client zone, all right? So when a patient one of our gold patients refers a patient, it's usually straight into the gold zone. So you've got this loop of referral that just drives these departments really, really, really nicely. And I suppose for a practice like mine, the gold patients really provide 80% of the practice income. not just by hygiene services and recalls and OHT functions and OHTs with adult scope. It's all the harvesting, etc., that happens from these patients. We've got 5 OHTs working here. It's like there's 5 dental examinations going on in one hour.
One time. Yep.
While I'm sitting around doing high production dentistry at the same hour, right? So there's this huge wave of high production dentistry that's just feeding into the dentist books as time goes on. And I think the thing that everyone needs to know, and I'm always amazed that about patients that don't treat these patients seriously, is these are the preventative care patients. These are the hygiene department patients. These are the patients that need to be treated differently, and they need to be treated seriously. These are the patients that drive the lifetime value of your practice. And, you know, there's a whole world of things that need to be considered here. And I'm not going to, I mean, we can talk for 3 days on this, but for me, I have a whole team of people that looks after this part of our practice for me. And I can spend marketing dollars and really target the type of dentistry that I want to do to get people to the customer level and rely on my preventative care department to drive referrals and just keep feeding itself as time goes on. And at the end of the day, that's how we all get paid, right, too.
Alrighty. So now we understand how important these gold patients are, and we're really starting to understand preventative departments as well. I wanted to sort of talk about now how we can really leverage the possibilities of these patients. You know, I know in the consultant world, leveraging is often discussed in terms of profitability. And I wanted to really explore leveraging initially in terms of the best interest of the patient, the best interest of the practice, and most importantly, for the best interest of the clinician themselves. So in order to do that, I think we need to uncover what the 3 roadblocks are here. So, you know, I think we all appreciate the fact that hygiene department roles, if left static, they become boring. I think we've all been bored at times. Everyone needs to change their mindset if these departments are going to become a sustainable solution for the practice and for the clinician and the patient. We need to understand this really early in our careers. I don't recommend waiting until you're 15 years in, as I did. You know, for hygienists and oral health therapists, our university training, it was great at teaching us to know exactly what we couldn't do. And it really honed in on, you can't do this, you're not a dentist, you can't do this, you can't do this, you can't do this. And as we left university, we kept in that really fixed mindset and often limited ourselves and didn't look beyond that. And I think now we really have to choose to enhance or concentrate on what we actually can do. Hygienists and oral health therapists need to understand ways in which they can really increase their service offerings. And dentist practice owners really need to find ways to support this as well through mentorship and providing training opportunities and actually just backing the team and letting them run with that and backing their abilities. You know, whilst repetition in our careers, it's inevitable, we need to really understand that we want to leverage our careers and we need to believe that we can, that it's actually possible. It's something that, I really needed to realize in recent times because I was absolutely going nowhere. Stuck. We need to understand what our actual clinical scope is too. And we need to understand what that means for our practice, for our patients, and, you know, for ourselves as clinicians. Moving forward, I think our goal is not to concentrate on the busyness of dentistry. As we often do, dentistry is busy, we get caught up. We really need to concentrate on our purpose, focus on seeking alignment with each other as healthcare providers and professionals, because I think then only then you can become intentional effective, and profitable. All right. So I guess now we've spoke about being intentional, and this is a really different concept for a lot of us. It was different for me, but it was really something that I had to investigate because I wasn't very intentional and I became undone. I've been working with David and the team here for 10 years and really hit the wall not long ago and decided this isn't what I want to do. I don't want to be an OHT anymore. It's not sustaining me. It's not purposeful, and I'm not being challenged. And for all of us, I think our clinical career can develop into that. You know, we fall into such a routine of sameness. The events of each day, we just go through the motions and forget what we're here for and what we're doing. If you choose to work with intent, though, it really means you're choosing to be deliberate and purposeful in everything you do. And I mean purposeful in word and in our actions as well. Because when you really actively engage in your role, I think you have the ability to respond rather than really react to the day. So everything happens around you. But when you have the ability to respond, you're kind of in control of that. So I want to explain now a few steps that I used, and I continue to use. I practice these to ensure that I'm actually being intentional. So I think firstly, and kind of most importantly, is to be engaged. I think this is the first step. You've got to be engaged with your team, with yourself, with your practice, and with your patients. If there's no engagement, then there's kind of no point to coming on in. One of the ways that you can do this, and this was a big change for me, is to really minimize the social chit chat with your patients and have some really purposeful or intentional conversations. Practice active listening, giving your patient your full attention, responding to their conversation rather than just passively listening. I kind of got caught up in that a lot, just listening to the banter and listening to what they were saying. Active listening doesn't just happen. You've got to, really choose to consciously listen and understand the messages your patients are giving you. I found that I had to really try and construct my conversations throughout the day rather than just rocking up into the treatment room and having a little chat to my patients. You know, having worked in the same practice for 10 years, my patients know me really well, sometimes too well, I think. We really have a connection, and it got so easy to fall into this social interaction. I forgot that I was a professional dental practitioner and I had a professional relationship to maintain. You know, make no mistakes, your patients and your practice, they actually need you to do this. Because social chit chat, it really downplays our professional role as a healthcare provider. And we've been given this opportunity and we really need to be purposeful and use it. So each day you have to set yourself a daily purpose and make this outcomes based. I tended to be rather task oriented and made a habit of, okay, what have I got to do today? That's right. 3 scale and root plane, quad debridement, some laser therapy, some whitening, and really didn't stop and think about what the outcome of each of those appointments needed to be, the messaging that I needed to give to my patients. So turning that around, I think you also need to construct yourself a yearly goal. And that's something that I've really started to do the last few years. And these learning goals of mine are based in mainly around CPD. I've got to work out what I wanted to achieve this year as a clinician. So for me, this can be really confronting. I had to admit what I wasn't really all that good at. How many standstill crowns did I place this year? 4 or 5. Did that mean that I was expert at placing those? Did I need to seek some more training from the best, from clinicians who did this all the time? We're often exposed to training delivered by academics. Are these guys producing? Are these guys doing standstill crowns all day, every day? So no, you need to work out who's going to be the best trainer for you and strive to be excellent. I have to constantly reassess the success as well and work out what went well, what I failed at. This is confronting because you've got to really, really be self-aware. It forces you to. You can't ignore what's in front of you. This is something too I really try hard to do. I work in a practice where there's 7 other clinicians, so it's 5 OHTs, and often I fell into the trap of comparing myself to the other clinicians. And it was a real failure, I think, on my behalf, because I'm not the same as a dentist or another hygienist. My role is different. My capabilities are different. My role is to compare myself to myself. Am I the same clinician as I was last year or last month? And be really driven to constantly improve for myself, for my patients, and for the practice.
And I think that's so true, Rob. Intention is plays such a huge role in modern day dental practice. And I think what I wanted to just go through now is talking about scope. And look, I think everyone understands what I'm about to say, but I'm trying to put it in a format that people can try and understand the ultimate power it will have as well. So look, as team members, we're all used to doing a whole bunch of things that team members are allowed to do. It might be admin, it might be doing steri, it might be assisting, it might be making mouth guards, it might be, for some team members doing other things like treatment presentations and treatment coordinating, etc. I'd encourage all team members as well to do whatever it takes to lift your scope.
Yeah.
Seek practices that really encourage that mindset of continuing to improve. You've got to show capability, of course, and you've got to show competence, but I think that should be the aim and the growth mindset that Rob's talking about in dental team members as well. But look, to step things up, we've got dental hygienists. Now, dental hygienists can offer a lot of other things that team members can't. We can, do some whitening therapies. We can do some hygiene and run our preventative care practices or departments, I should say, and also assist in the treatment of perio and our perio programs. We add OHTs into the mix, and we can add an additional service for the treatment of children. And now, of course, we've got OHTs with adult scope where we can get these clinicians to help us out doing some of the adult restorative. This is not by the way, I'm not trying to set up an ego bloody scale here. It's just that APRA and our regulators, of course, will identify different scopes for different clinicians. It doesn't mean one's better than the other. And because I've got the dentist at the top of the list doesn't mean we're better than anyone else. It's complete bullshit. And it's what often holds us back is that, I hear constantly, oh, they want to do fillings on teeth. Why don't they go and do a dental degree? Well, that's complete bullshit. They can do these things. They can do them very well. Sure, they've got to prove their competence and prove their capability. I'm not against that at all. But they're very well trained and they're very well served to provide all of these services. But as a dentist and a dental specialist, these are the sort of things, and this list is not exhaustive. They're the things that really the other clinicians really aren't allowed to do in their scope. All right. Now, in a multidisciplinary model, we all want to be improving our scope. Doesn't matter what you are, whether you're a team member, a hygienist, an OHT with adult scope, even dentists and dental specialists. If you're a dentist that's just doing adult restorative and sitting around doing fillings all day, think about growing, think about lifting, think about thinking about doing these higher production, more interesting treatment modalities for your patients. Do them well, learn from the best. It's all worthwhile and adds to everyone's career satisfaction. I think personally at the moment there's an enormous opportunity for OHTs to add their adult scope. I think, that to me is, I just think that's a big deal for private practices at the moment, and all adult OHTs that maybe don't have an adult scope qualification at the moment should seek that out. Talk to your practice owners about it, and seek out some good real world courses, and we'll be talking some more about those on the Facebook group later in the coming months. But I suppose there's even a whole bunch of other stuff I haven't even listed on here as well. And it's for dental hygienists, for example. I mean, we can get into orthodontic assisting, we can get into myofunctional therapy, we can get into dental sleep medicine, we can get into a whole bunch of stuff, which I haven't even listed here. So the list is really limited by your thoughts.
Yeah.
And, you know, that's what we're trying to unlock here. So how the heck do you do this? How the heck can you get a bunch of clinicians that all can do different things, and you know, how does that get managed in the practice? Well, this is our idea, of course. This is very common amongst a lot of the practice consultants, is that all clinicians, and look, team members as well, are the same as this too, need to be calibrated. Everyone needs to communicate and everyone needs to collaborate. So when we talk about calibration, we talk about it in two forms. We talk about it clinically, and we talk about it diagnostically. What's essential in sort of any dental practice? I don't care how big it is understanding that everyone has to be clinically calibrated and demonstrate clinical excellence. I think we can't have situations where you've got one good clinician, that's, you know, their fillings are falling out every 5 minutes, and all those sorts of things. That needs to be sorted out. Everyone makes mistakes. There's no problems. You know, things like provide a standard of care, loops, photographing your cases, have case study discussions, seek some mentoring from your practice owners or those other colleagues around you that are the best. Okay, clinical calibration is very important because everyone's got to be confident that everyone can do the job that they're proposing that they can do. In a bigger group practice like ours, sometimes we've got situations where, you know, one OHT might be treatment planning a kid, for example, and another OHT might be doing the treatment. So that doesn't work at all unless there's some clinical calibration and of course some diagnostic calibration, which I haven't spoken about yet. So in diagnostic calibration amongst clinicians, there must be consistency. There must have a series of agreed practice diagnostic guidelines. And we do this regularly in our group. The 7 or 8 of us sit down and discuss robustly how the hell we're going to diagnose perio, for example.
Yeah.
How are we going to diagnose early caries and whether it should be treated or not? How are we going to diagnose cracked teeth and whether they need full coverage restorations, for example? There's a whole world of stuff that comes up regularly, and given there's a lot of unusual stuff that happens too, but think about as many of those standard things that you have and agree wholeheartedly and get consistent on how that's going to be diagnosed. The second thing that everyone needs to be aware of is what the practice offers. I mean, I've seen situations where team members don't even know that the practice does implants, or some of the team members don't even know that you treat children or whatever. Spend some time with your team members, with your clinicians together to get these things right, because consistency is everything. Patients pick up on inconsistency and walk all the time. Very, very important. Let's talk about communication. So obviously as a team, communication is very important amongst team members. We all know about that. You could talk for 5 days on all those sorts of things. But in terms of clinical communication, again, have a good, thorough, robust debate with your fellow clinicians and have an agreed set of communication tools. How are you going to talk to people about perio? How are you going to talk to people about the fact they need a crown? How are you going to talk about all of these other harvesting tools that come up in daily practice? Have it as a consistent function, so no one's flying off the handle trying to talk about things in their own way. Okay. We can improve communication by definitely the use of technology. I mean, look at EMS. The hosts of our night time in the guided biofilm therapy protocols is a wonderful communication tool for our patient. Drives retention strategies also. Use of intraoral cameras, cone beam CT, all those sorts of things. Diagna cams, CAD cam monitoring, which I think is going to be the future. I suppose CAD, particularly for perio, I believe that CAD cam intraoral scanning sort of integrated with cone beam CT will eliminate the need for perio charting or create heat maps for where dental disease actually is. Be on top of these technologies and understand where everything's going, because when we have technology that changes patients' perceptions of what's wrong to being real, overcomes a lot of hurdles in case acceptance, because you're not taking my word for it. This is actually what's happening. Look, AI, so artificial intelligence, is now poking its head out big time in dentistry. We're seeing lots of apps coming in online. Dental monitoring, for example, have been in the orthodontic space for a while now. They're coming up with some really neat ideas for patient monitoring, not just orthodontic monitoring, but talking about monitoring our patients and using AI. Very, very interesting future there. And I think they're great communication tools for the same reason. You're not making it up. We're watching these areas deteriorate. We're not making it up. This is your problems, right? We use a lot of aids and in our practice, patient scorecards. We're showing photos of what we consider normal and maybe what their condition is right now. We use nurturing patients, nurturing sequences, emails, SMS, video content, where we're really trying to communicate with our patient base regularly, and information-based marketing. I mean, we recently did I think Dental Health Week was how much sugar's in your trolley this year.
Yeah.
I mean, we had a brilliant, wasn't written by me, of course, because I failed English at school, but a brilliant set of emails. I think it was an 8-email sequence that went out to about 8,000 of our active patients and had to be opted in. And we had 5,000 of our patients opted into this story about Willy Wonka. Willy Wonka's dad was apparently a dentist. I can't remember the movie myself, but it just went through this journey of this fictional kid that was based on the movie, but just delivered a whole bunch of information to patients about the theme of Dental Health Week. And it was one of the most successful patient nurturing campaigns that we've ever had, with a 50% or more opt-in, which is unheard of in patient nurturing emails content. We also, of course, can use social media. We can use online coaching. We've recently started doing that since COVID. I mean, everything, we're on Zoom tonight. I've been on Zoom in my life till this year, but online coaching, we were doing it with some, well, not me, but the girls were doing online coaching with some young children, for their mothers, helping them at toothbrushing time at night time, and just some really, really innovative ideas to help communicate messages and have our patients feel well supported. And I suppose the last how is to collaborate. And this is really, really important. This is really important to shrug off the egos, to understand that we're all oral health professionals. Let's work together for the greater good of the people we serve, and they're our patients. And patient care has to be in the multidisciplinary model about collaboration. As a dentist, I refer a lot of dentistry to dental specialists all the time, and I feel, whilst that works out okay most of the time, the collaboration is usually pretty poor. We all write preconceived emails to each other and letters, and no one really knows what happens in the middle. But this model works very well in perio practices, for example, that hire dental hygienists. I think that that model is a sensational multidisciplinary model because everyone is in-house, is collaborating on each case. I think the future will be having dental specialists in this model, of the multidisciplinary model. It's just adding another layer to scope that, you know, the dentists don't have or aren't comfortable in doing, which is completely fine. But that will improve collaboration. Improve collaboration improves patient care. There's no question about that. So measuring success, and, you know, this is one of the things as practice owners we all get a bit excited about because, well, we're all running businesses, right? And it's an important part of this, and this is where often I think the waters get a bit muddy. I view it like this. I view it like, well, the iceberg. So we've got a bunch of stuff going on that we can see, and there's a bunch of stuff going on that we can't see. The stuff that we can see is what I refer to as, and I'm not the only one, this isn't my idea or anything, but the tangible things. So practice owners love tangibles, they love data. We're all computer, we're all nerds, we all love numbers, and we all like to count and add stuff up and work out how good we're going and all those sorts of things. And we are all running businesses, and KPIs and metrics are really important. They're really important for a whole bunch of reasons to make sure we're staying profitable. We're all okay with that, keep banks happy and whatever. I think KPIs and metrics also identify things that need improvement, and it's working out what the right KPIs and metrics are for you. I mean, just an example, I've picked on Robyn here. There's little dashboards that we run in our practice about, you know, watching production grow over time, over the years. We look at charge out rates, making sure they're reasonably consistent. We don't want to see peaks and troughs. We're looking at new patient numbers. Downtime seems to be negative this month because we're still catching up from COVID. But importantly, looking at reappointment rates, and we want them to be as high as possible. Again, that just proves that our retention strategy is working very well. Harvesting rate, which refers to how successful we are at diagnosing treatment in our preventative departments and converting that into an appointment for high production dentistry to be done with the dentist. Keeping an eye on OHT and hygienist utilisation as well. And this will differ based on your scope. So the four things we keep an eye on in the preventative department, for example, is perio. On treatment of perio, we like to make sure that our perio treatment numbers, particularly for our new patients and our patients in maintenance that have perio, is, you know, what we think is the community norm. We want to look at preventative, all right, which is what we're doing as part of that's our retention strategy, but also, you know, adult restorative and pediatric dental care as well. Obviously, if you've got a clinician that's an OHT with adult scope, you would expect to utilise them more for adult restorative than probably preventative, possibly. But, you know, that's something that just really, you want to make sure you're utilising the right skill set, and you're really wanting to utilise everyone's scope and trying to get everyone working at the ceiling of their scope. Then we've got a whole bunch of stuff that's going on under the surface. And look, I think sometimes when there's an argument that a OHT or a dental hygienist isn't profitable, etc., I think we forget the intangibles. Okay, I'm not saying this is foolproof, and you've got to have good people, and you've got to have the right people, and you've got to have the good leaders, and you've got to all those things. But there's benefits that are somewhat hidden in all of this. Oops, I went too far. Where I'm going with all this, it's really important that we remember that all of our team members are a really underutilised resource in dental practice. And I know what it's like. You sometimes feel like the whole thing relies on you as the practice owner. And practice owners especially should listen to exactly what Rob was saying, is just letting go. Understand that your team members, your other clinicians are very, very capable for the most part. As we mentioned, particularly dental hygienists and OHTs, critical thing is they're well educated, they're very skilled, and they're very passionate about their profession. Leverage them. And if they're well mentored, understand that they are very well trusted by your patient base. They have enormous amounts of goodwill. They develop pretty amazing relationships with patients. And along with really effective team members, the huge amount of power driving practices forward is the fact that in the patient's eyes, these people have no perceived agenda. If I go talk to someone about doing a whole bunch of dental treatment, we've all heard it before. Patient, oh, you just want to buy your new Porsche next month, do you? These team members and clinicians are often perceived to be patient advocates, and it drives enormous power for practices to thrive. And I think these intangible factors are often forgotten. It's often sometimes an ego thing. I think dentists think they have to do it all. I'm telling you right now, most of the biggest cases I've ever done have been treatment planned and discussed by people other than me. Lastly, as far as an intangible hidden benefit of having OHTs and dental hygienists in your practice is understanding that lifetime value of your patient really equals retention plus the harvesting of high production dentistry plus that referral loop of family and friends of these patients as well. That is a huge kicker. It's something dentists don't do well. They don't have time to do it. And it's so much more than an item number grab.
Yeah.
Sorry.
Okay, so I guess in summary now, I guess it's getting late and everyone's wanting to go to sleep. Dentistry is transforming, and we're all sort of seeing that. I think we need to also transform as practitioners, transform in our thinking mainly. David and I love the multidisciplinary approach and think that's how everybody should practice dentistry, but realizing that not everybody does, but really opening your eyes to the opportunities that preventative departments offer. I think we have to stop our self-limiting belief. Dental practice owners have it, and OHTs, hygienists too. Carol Dweck, one of the great researchers on growth mindset, like she says, growth mindset is the belief that the abilities can be cultivated. And I think we need to believe that our clinical ability can be cultivated. The growth mindset, it's a starting point for change, but we need to decide for ourselves where our efforts towards change will be most valuable. And for me, I think they're going to be most valuable in increasing the scope. Why would you want to limit your clinical competencies? Can you increase your scope? And would this then create a world of opportunity for you, your dental team, and your patients? What are your patients missing out on if you can't perform all of those duties? And it would really ensure that you're a linchpin within your practice if you can scope yourself up. Do you want to become a master clinician? I think it's something we all need to ask ourselves. Do we want to reach that panacea or the point of self-actualization that you actually are a master clinician? And how do you get there? So I think moving forward, if you want to be at the top of your game, you've got to commit to excellence in clinical skill and communication skill, and always pursue that maximum. Find some great mentors.
And definitely, and I'll just end by just saying there is absolutely no doubt that all oral health professionals can all work together, and team members for that matter. I never want to exclude team members from this conversation. to achieve outstanding outcomes for the people we serve, our patients, but also for our practices and ourselves. I think career progression and satisfaction is something that dental hygienists and oral health therapists often somewhat don't think about or aren't encouraged to pursue until they get a fair way in, I suppose. But look, I hope this talk was helpful. I don't really know. I was yelling and screaming at the TV last night. I feel like we can't really talk. But please join us on the Dental Health Network. I encourage you all to join the group. I try and start some controversy at times, but it's really just to start some conversations that I think need to get out there. And I think the group does a really great job at doing that. Everyone's really respectful, and I think it's really interesting. And we're going to be doing some stuff in this space in the oncoming months. So look out for that, and we hope as many of you can join us as possible. But thank you to EMS again, and Danielle and Tabitha for inviting us to speak. And we hope you have a good night and sleep well. But I'm happy to answer any questions if there are any.
Thanks so much, David and Robyn. I really enjoyed the presentation, and I'm sure everyone else did. It was eye-opening and extremely motivating. I need to lift my scope. I've written that down as the #1 aim.
Number one message.
That's it, yeah. Now I'll open up the floor to any questions, and let me just open up to see if there's anyone. But obviously, if there's any further questions, then they can jump in the group as well, or type them below, and you guys will get back to them in due course. But yeah, there was so much information in there that's going to be helpful, and there's been a significant amount of people watching one of our highest Facebook Live videos. So thank you very much.
All righty. Thanks, Danielle.
Thanks, Danielle.
Doesn't look to be any questions, so I think you must have answered everything. I think everyone's, writing down how to improve their scope. That's it. Thank you so much. Enjoy your evening.
Perfect.
Thanks again.
Danielle.
Thanks, David and Robyn.
Okay.
Cheers. Bye.
Bye.